Hello, my name is Kristina Kitsos and I'm a registered nurse. I specialize in aesthetic medicine. One thing that is really near and dear to my heart is people who struggle with acne, because I myself had a really difficult struggle with acne, so I know how they feel. I have an amazing client, Madi Monroe, and she has had a quite tumultuous acne journey. When I first met her a few years ago, she had a ton of breakouts on her face, and we took a lot of sessions, many sessions, I can't even count how many. We did extractions, I got her on proper skincare, I taught her different tips and techniques to keep her skin clean, and she has actually been a great student. She no longer goes to bed with makeup on, thank God, and now her skin is 95% clear, and we are just gonna work on getting rid of some of the red little marks that come from when you've had a lot of acne. So it's kind of like scarring. They're not pitted scars, but it's just an uneven skin tone. So my go-to for that is IPL photofacial, and we're gonna do it on her today. So this is water-based ultrasound gel, and it just helps to protect the surface of the skin from the heat from the IPL. 1, 2, 3. How is it? Doing so good. You're doing so good.
It's actually not that bad. It kind of just feels like laser hair removal.
Yeah, and plus we didn't even have 1, 2, 3 the numbing on for that long, because Maddie, as always, is in a rush. She's got so much on her agenda, like kind of like me. Last one. Yay! So the IPL photofacial is really great because it uses different wavelengths of light to hit different chromophores. A chromophore is like a target. So for somebody that has excessive redness, that would be hemoglobin in blood. So a lot of extra maybe capillary blood flow. We want to even out the skin tone, so we get rid of the superfluous vessels that really don't function, they don't do anything for you except for just make your skin look like mottled. And then the other chromophore that I attack with the IPL is melanin. So people that have brown spots, age spots, just like a discoloration in the skin, post-inflammatory hyperpigmentation for people that pick their skin and then it becomes inflamed and their bodies create more pigmentation because of the inflammation. I also use my IPL for that. And then once we get the skin color evened out, then I used a different setting to stimulate collagen and really help the texture of the skin.
I had like really bad bumps under my skin, and then she was like, we can just do some Botox and it'll clear up. So yeah, but it's helped literally so much.
So we're gonna do a little Botox. Put your brows together and then lift up. And how much has the Botox helped with little pimples?
Oh my God, it literally has helped so much. It's actually crazy. I tell my friends, I'm like, oh, do you have those things? I'm like, don't worry, just get Botox.
It's not necessarily Botox like to try to freeze your face. It actually really helps with the texture of your skin and breakouts and all that. So we'll do that, and then since we've cleared up your skin so much, I mean, it's like night and day.
It's literally night and day. And I stopped touching my face a lot. So.
Hey, following the rules is always important. Follow the rules. So what we're gonna do is we'll do that little baby Botox, the sprinkles up here. So Botox gets a bad rap for young people. And the reason that I think it's a good idea is because it is really preventative. It helps with aging, it helps with acne breakouts, and it actually really helps for headaches. It also helps for really oily skin. And Maddie has all of those things. She has oily skin. She has breakouts in her forehead. She gets headaches. And so it's really been life-changing for her. The other area that I did today on Maddie was a teeny little touch of Botox at regular strength on the sides of her eyebrows here, and that gives ever so slightly a little bit of a brow lift. Today on Maddie, we also did this area, which is called the frown lines or the glabella. That area really is important to preventing headaches because the small movements when you frown, most people do it inadvertently, it actually causes a little bit of tension, and that tension, when it adds up, causes a headache. So pain for Botox is very minimal. Most people say they can't really feel it. There are a couple areas, one right here and one right here. This is where the nerve bundle comes out from inside of the skull, and so the likelihood of it being a little more sensitive in these two injections is a little bit higher. but I have never in the last 17 years had anyone ever say that they don't want to do Botox because it's too painful.
Oh, look at me.
It's good. So what are we gonna not do tonight? We're not gonna work out, don't drink alcohol.
I never work out, so.
Good, perfect. Don't do any like headstands or like hot yoga. Don't massage your face. Don't go get a massage and put your head, you know, down in there. Just kind of let everything be and let it all heal.
Okay, can I put makeup on?
You can. I would wait at least an hour or so before you put makeup on, but you're good. With the IPL, you can definitely put makeup on, no problem.
Cool.
Thank you.